Good day. We are going to talk about the fat-soluble vitamins. The fat-soluble vitamins include vitamin A, D, E, and K. And this is to remind us of the differences between water-soluble and fat-soluble vitamins regarding the absorption, which one passes directly to the blood, and which one passes to the lymph first and then goes to the blood. The transport, which one travels freely and which one may require carriers, protein carriers. The storage, which one circulates freely in the body tissues and which one is stored in the fatty tissues. The excretion and toxicity, both of them are related together. The excretion is easy, readily for the water-soluble vitamins, and so it is possible to reach toxic levels when consumed from supplements. But this is not easy if compared to the less readily excreted fat-soluble vitamins, so likely to reach toxic levels. The requirements needed in frequent doses for the water-soluble vitamins and needed in more spaced doses, perhaps weekly or monthly, for the fat-soluble vitamins. We'll start with vitamin A. Vitamin A is closely related to another compound called beta-carotene. In foods, retinyl esters in animal foods give the retinol, which supports reproduction. And the beta-carotene in plant foods, compared to the retinyl esters in animal foods, the beta-carotene in plant foods gives retinal. And you can see that there is a reversible conversion between retinol and retinal inside the body. Retinal participates in the vision. Both of them, retinol and retinal, can be converted to retinoic acid, which regulates and important for growth. Vitamin A in vision. What is the role of vitamin A in vision? If you see this diagram of the eyeball, when the light rays, they fall on the retina. When the light falls on the retina, they act on the receptors, the photoreceptors, which are the rods and the cones. When the light falls here, it initiates or it stimulates or it starts this reaction, the transformation of cis-retinal to trans-retinal. When this conversion occurs as a result of the light falling on the retina and the photoreceptors, this reaction stimulates an action potential in the retina that passes to the optic nerve fibers and then the optic nerve going to the brain. Vitamin A in protein synthesis and cell differentiation. Vitamin A maintains healthy cells in the mucous membranes, like this picture. This is a diagram of a healthy mucous membrane. Without vitamin A, the normal structure and function of the cells in the mucous membranes are impaired, and see how the mucous membrane is deteriorated compared to the normal picture of the mucous membrane in healthy individuals without vitamin A deficiency. Vitamin A in reproduction and growth. Beta-carotene is an antioxidant. Vitamin A in the foods, it gives the vivid colors for the vitamin A rich foods. Vitamin A poor fast foods, vitamin A rich liver. Other names for vitamin A are retinol, retinal, retinoic acid, and the precursors are the carotenoids like beta-carotene. In 2001, RDA for men was 900 micrograms per day, and for women was 700 microgram per day. The upper level for adults, 3000 microgram per day. Sources for retinol, the animal sources like fortified milk, cheese, cream, butter, fortified margarine, eggs, and liver. For the beta-carotene, spinach and other dark green leafy vegetables, broccoli, deep orange fruits, apricots and cantaloupe, vegetables like squash, carrots, sweet potatoes, and pumpkin. If we look at the rich sources for vitamin A among the food groups, we can notice that the cornflakes, the fortified type, has got a high content, the broccoli and carrots for the vegetables, tomato juice, and we go down for excellent and sometimes unusual sources, the beef liver, sweet potatoes, and mangoes. Chief functions in the body. Number 1 is vision. Number 2, maintenance of cornea, epithelial cells, mucous membranes, and skin. Bone and tooth growth, reproduction, immunity. Deficiency gives rise to hypovitaminosis A, with symptoms on the eye, giving rise to night blindness, corneal drying, which is called xerosis, triangular gray spots on the eye. These spots are called beetle spots in the sclera, or in the white of the eye. Softening of the cornea, called keratomalacia, corneal degeneration, and blindness. This is called xerophthalmia. Other symptoms: impaired immunity, and this gives rise to repeated infections, and plugging of the hair follicles with keratin forming white lumps, and this is called hyperkeratosis. This is a picture of beetle spots, the triangular grayish spots in the white sclera of the eye. It's manifestations of vitamin A deficiency. Toxicity gives rise to hypervitaminosis A, and the toxicity can be acute or chronic. Acute toxicity symptoms gives rise to blurred vision, nausea, vomiting, vertigo, increased pressure inside the skull, increased intracranial tension, mimicking or resembling brain tumor, headaches. Chronic toxicity symptoms give rise to increased activity of osteoclasts, causing reduced bone density, liver abnormalities, and birth defects. Vitamin D. Other names are calciferol, 1,25-dihydroxy vitamin D, or calcitriol. Animal version is vitamin D3 or cholecalciferol. Plant version is vitamin D2 or ergocalciferol. Precursors is the body's own cholesterol. So the cholesterol is a precursor needed for the body in order to form vitamin D. In 1997, the adequate intake between 19 and 50 years is 5 micrograms per day, and from 51 to 70 years is 10 micrograms per day, and above 70 years is 15 micrograms per day. We noticed that the requirements of vitamin D increase with age. Upper level for adults is 50 micrograms per day. Chief functions in the body. The most important function is mineralization of bones. It raises the blood calcium and phosphorus by increasing the absorption of calcium from the intestine, and by withdrawing calcium from bones, stimulating retention by the kidneys. Significant sources include synthesized in the body with the help of the sunlight, fortified milk, margarine, butter, cereals, and chocolate mixes, veal, beef, egg yolks, liver, fatty fish like herring, salmon, and sardines, and their oils. For the body to form vitamin D, we need 3 steps. First step is the skin. By the help of the ultraviolet light from the sun, it gives rise to vitamin D3. And from the foods, we need cholesterol in order to form the first step of vitamin D formation, which is of course inactive. Then this inactive vitamin D3 goes to the liver, where there is hydroxylation reaction forming 25-hydroxy vitamin D3, and the final step for the complete activation of vitamin D occurs in the kidneys, and also it is a hydroxylation reaction. It gives rise to 1,25-dihydroxy vitamin D3, which is the active form of vitamin D. Deficiency symptoms gives rickets in children and osteomalacia in adults. Rickets in children is characterized by inadequate calcification, resulting in misshaped bones with bowing of the legs, enlargement of the ends of long bones, especially in the knees and the wrists, deformities of the ribs bowed with beads or knobs, delayed closing of the fontanelles, which are the spaces between the skull bones, with rapid enlargement of the head. Usually the anterior fontanelle normally closes by the end of the second year, while the posterior fontanelle normally closes by the end of the first year. Lax muscles, resulting in protrusion of the abdomen and muscle spasms. In adults, the disease due to deficiency is called osteomalacia, characterized by loss of calcium, resulting in soft, flexible, brittle, and deformed bones, progressive weakness, pain in the pelvis, lower back, and legs. Toxicity gives rise to hypervitaminosis D with elevated blood calcium, calcification of the soft tissues like in the blood vessels, kidneys, heart, lungs, tissues around the joints, and frequent urination. Vitamin E, other names are alpha tocopherol, the RDA in adults 15 mg per day, upper level for adults 1000 mg per day. Chief functions of the body, it's an antioxidant, and this property stabilizes the cell membranes and regulates the oxidation reactions with the protection of the polyunsaturated fatty acids and vitamin A. And this diagram shows how the body deals with the free radical formation and the role of antioxidant formation. The free radicals, when left with unpaired electron, this molecule is a free radical with unpaired electron and attacks another nearby molecules. Usually the attacked molecules are the cell membranes, leading to widespread damage. In the presence of the active vitamin E, it stabilizes the free radicals, and so instead of the free radicals getting stabilization by damaging the cell membranes, it uses the active vitamin A to be stabilized, and this is the antioxidant property of vitamin E. Sources include polyunsaturated plant oils like margarine, salad dressings, shortenings, leafy green vegetables like wheat germ, whole grains, liver, egg yolks, nuts, and seeds, and it is easily destroyed. The vitamin E is easily destroyed by heat and oxygen. Deficiency gives rise to red blood cell damage or hemolysis, and as well as nerve damage. Toxicity symptoms augments the effects of anti-clotting medications like warfarin, for example. Vitamin K, other names are phylloquinone, manaquinone, manadione, and naphthoquinone. In 2001, the adequate intake for men is 120 microgram per day. For women is 90 microgram per day. Chief functions in the body: synthesis of the blood clotting proteins, the clotting factors, and synthesis of bone proteins that regulate the blood calcium. Significant sources: it is synthesized by the bacterial flora. Other sources include the liver, leafy green vegetables, cabbage type vegetables, and milk. Deficiency gives rise to hemorrhage, and there are no toxicity symptoms. Again, we have a look at the antioxidant nutrients in disease prevention. If you look at this diagram, occasionally oxygen gains an extra electron from the electron transport chain, which generates this free radical called the superoxide radical, which is a molecule of oxygen with an extra and unpaired electron. Any compound with an extra unpaired electron is considered a free radical. The superoxide radical can gain another electron, again from the electron transport chain, and react with two hydrogen ions to form hydrogen peroxide, which is another free radical. So we have the superoxide radical and the hydrogen peroxide, and if it gains another hydrogen to form another free radical called the hydroxyl radical, and finally water. Free radical chain reaction and damage. The hydroxyl radicals are highly reactive, wanting to match their unpaired electrons. For example, they might take electrons from the lipids of the cell membrane, which causes damage that gives rise to degenerative diseases. So when hydroxyl radicals takes a hydrogen atom from a lipid such as the polyunsaturated fatty acids, it generates a lipid radical plus water in this reaction. This lipid radical can in turn react with oxygen to form another lipid radical, which can in turn remove hydrogen atoms from other lipids, producing new radicals and thereby initiating a chain reaction. The antioxidant production. Antioxidants interact with the free radicals and break the destructive chain reaction that damage the tissues. Vitamin E gives up one of its hydrogens to the lipid radical, and the result is that vitamin E is no longer active, but it has successfully stopped the free radical damage of the tissues. Vitamin E can be reactivated again by accepting a hydrogen atom, and from fellow antioxidant vitamin C, for example. Vitamin C can reactivate the vitamin E, and the vitamin C's two structures are presented before the conversion between ascorbic acid and dihydroascorbic acid. Thank you very much.